Hi, welcome to this video. It's in relation to a presentation I gave at the Society for Academic Primary Care, or the SAPSI conference yesterday. I thought I'd I thought I'd give you the chance to comment, see it yourselves. It's a much shorter version, of course. Alright, I was presenting on the topic of IBS patients' attitudes to hypnotherapy. Essentially, or perhaps more so, why are people with IBS not interested in hypnotherapy? We have a great deal of evidence that suggests that hypnotherapy is an efficacious treatment for irritable bowel syndrome, specifically refractory irritable bowel syndrome. I'll come back to that later. But first of all, let's look at the problem of irritable bowel syndrome, IBS, more generally. Okay, so it's got a global prevalence rate of around 10%. Figures always vary a little bit, but it comes in at around 10%. It's expensive. It costs a huge amount of money, both to have and to treat irritable bowel syndrome. The NHS, National Health Service, spends 50 million on antispasmodics and laxatives alone, but actually the majority of what they spend is in general practitioner, primary healthcare provider time, contact time, and of course it causes a great deal of misery for those who experience it. Not only the direct symptoms themselves, but the effect it has on their lives, the limitations it produces, the anxiety and the depression it causes. So it's a big deal and worth investigating and being aware of potential treatments for it. Now, back in 2008, NICE, the National Institute of Care Excellence, or Healthcare Excellence as it is these days, included hypnotherapy in their potential treatment pathway for IBS, specifically for refractory IBS that I referred to earlier. Now, if you don't know, refractory IBS is IBS that has proven resistant to initial treatment and has then developed an ongoing profile of symptoms that have lasted for a minimum of 12 months. So it's sort of, IBS that just doesn't go away. And it has been found that hypnotherapy is quite good, actually, at treating refractory, this particular group. It's not necessarily actually any better at treating general irritable bowel syndrome, but for this group of people who experience this long-term IBS, there's good evidence that hypnotherapy is a particularly efficacious treatment, which is why NICE, arbiter of good practice in the UK, decided to include it in their guidelines. Okay, so what are my initial findings? Because what I've been doing is I've been interviewing people with IBS about their attitudes and opinions towards hypnotherapy to try and find out what it is that might be holding them back, if anything. And I'm still doing that, I should point out, and I will be asking you if you know anybody who fits that category in the UK, because I would love to talk to them. But my preliminary findings. Okay, so I've got two elements. There's what I like to call the cluck like a chicken factor. This was almost the very first thing that was said to me on the very first interview. They won't make me cluck like a chicken, will they? To which of course I said, no, they'll make you bark like a tree. But it does highlight something that probably everybody knows on some level. Hypnotherapists, non-hypnotherapists probably know that there is this association with entertainment in hypnotherapy. We all know this. Most people's knowledge and understanding of hypnosis comes from entertainment. But sometimes perhaps it's not given enough credence as a potential barrier to treatment. It's not necessarily that hypnotherapists are seen as powerful and evil, or they're seen as scientific in any way, but actually they're seen more as entertainers, or seen associated with entertainment, which of course undermines clinical value. That sort of vaudevillian music hall association undermines potential clinical value. The other, and possibly more significant of the two findings, is that people just don't think about a mental approach for a physical problem. It's not where they go to naturally. Now, there's a lot of research about how affecting the mind can affect and improve physical symptoms. Within hypnotherapy, there's a lot of work on pain, and a lot of people use, say, meditation for pain. But that hasn't necessarily translated into the world of IBS. So people with IBS aren't naturally going, oh, hypnotherapy, that'll help me. They're just not thinking of it because there's this mind-body disconnect that we have. But actually, of course, the mind does affect the body in much the same way that the state of the body does affect the mind. These two are reciprocal. So possibly there's work to be done on getting the message out there that how you think, how you perceive things mentally can actually make a significant difference to your symptoms. Can actually send a message to the body to be different. And it does seem that that message hasn't really got out there at all. So that may be one of the major barriers. Okay, the work is still ongoing. I still need to interview people. If you know anybody in the UK over 18 who's never had hypnosis for IBS, who would be willing to talk to me, I would love to hear from them. If they've got that diagnosis of refractory, they won't have ever been described as refractory, but if they've had some form of standard treatment and 12 months later they've still got a problem, then that's the people I want to talk to. If you know anybody like that, I would be really grateful if you could pass on my telephone number. That's 0739 295 7945. That'll be in the comments as well, and you'll find it in the associated blog on this. Please do get them to call, or at least pass on my number and ask if they'd be interested. I would love to hear from them, and the more information we've got, the more accurate this can be. So that would be brilliant. Thank you very much.